Here at Northeast Youth and Family Services, we offer a variety of community services and mental health supports to children as young as 4 all through the lifespan. We really hone in on, though, and focus on kids and their families, and we have a wide variety of services available so that we can support the community in all of their needs.
The core part of our mission is really about reducing barriers to access to care. And this includes reducing financial barriers through our sliding fee scale, logistic barriers by helping with things like transportation and ensuring access through telehealth, linguistic barriers by ensuring highly trained interpreters are working collaboratively with our providers, and we reduce cultural barriers by ensuring that our clinicians are well-trained in culturally responsive care and by working hard to ensure that our providers reflect the clients that we serve. Child-centered play therapy is an intervention that is used with youth, typically between 3 and maybe 12 years of age, who have a mental health condition or a stress or a trauma in their life that they want to heal from. We have special play therapy rooms. We've done specialized training with the staff, and play therapy is a really beautiful intervention because it allows the child to heal in a developmental way that is deeply tied to the developmental work of childhood, which is play. Art therapy is an intervention for individuals that need a different medium for being able to access the underlying concerns that they have related to mental health or other life stressors. You don't have to be good at art to be able to do art therapy, and art therapy is for all ages, but allows folks to have a different way of processing maybe challenging or difficult emotions and thinking through the life experiences that they've had.
This intervention is really critical because what we know about youth is once they're entered into the criminal justice system, they often stay there. If we can get them and divert them from that system, we can change the trajectory of their life. In our Community Connections program, we're helping teenagers who might be isolated or just mixed up with connections that aren't healthy for them, a peer group that's influencing them in a negative way, and we want to give them some skills to be able to differentiate that and to choose, who they want to align with and build those positive connections from the beginning. So they have a peer group that they participate in the program with, and then they're also going out to community spaces and meeting other positive adults that can support them in their development. So our community advocacy program is where we partner with 5 local police departments, and we offer alternatives to law enforcement intervention. Somebody who is struggling with their mental health and they're getting police calls, but police is really not the most appropriate response. What they need is connection to community resources and referrals and somebody to be a bridge to that for them. And that's what our community advocate offers.
The co-partnership between NYFS is extremely important, especially with early intervention. I think how complex and large the criminal justice system is, if we can have early intervention to these kids, they get the resources they need, they get the help that they need. The last time I saw was over 90% success rate when they go through diversion versus through the criminal justice system. And I think that's really important. Once you impact one child, you impact the family, you impact the neighborhood, you impact the community.
Our Restoring Power program's purpose is to reduce incidences of domestic and sexual violence in our communities, of which we know there are many and very few services available that allow folks to walk into a center and receive care from an advocate or from a therapist that is specialty trained.
We're working with folks who have been through really disempowering experiences, so we're trying to work with them through many different ways to help themselves gain that back and feel empowered again. How could you not feel hopeless when you're stuck in a situation that feels impossible to get out of? But I really value being part of the process of hopefully them realizing that there is hope and that there are things that they can do to heal and move on.
Our school-based model is unique in its dedication to being an embedded model. We really see the partnerships with the school districts as important as our relationships with the individual youth on our caseloads. Our goal is to really help the entire school itself increase its capacity to respond to the social and emotional needs of youth so that those youth are then able to learn more effectively.
I think one of the cool things about being in the school is that we take down that barrier to access. The kid's job is to be at school. We can just support them where they are. One of our therapists just closed with a young man. He just finished 8th grade. At the beginning of 7th grade, he had 8 office referrals for behavior situations. As she worked with him, her goal was for him not to get arrested because he was just engaging in so many risky behaviors because he didn't feel hope. He didn't see how he could overcome the trauma and pain he had experienced in his life. She just closed with him at the end of 8th grade. After working with him for a year, he has hope. He's about to start high school. He believes he has a career path that he can follow. And in 8th grade, he had 0 office referrals. So to go from hopeless and just expecting the worst from life to having a goal and a dream, it was just incredible to see and hear.
It just helps you to know that, like, if something's going wrong, you have at least one person in your corner that you can talk to and they'll just listen. This place has affected my entire, like, teenage years. It's helped me with relationships. It's helped me cope with my past, and it's gonna help me change my future.
We are providing really intentional, high-quality care to our communities that folks are able to come in, know that they're going to get better, receive care that is attuned to their individual needs, and where they feel deeply valued and honored for the humans that they are.